Just don't use the mic. Just speak loudly. Sure.
Thanks, everybody, for being here again today. I will have the directors here today. I'm going to give Director Carson will be up here shortly to be able to speak about some of the issues she's doing on distribution of the PPEs and some of the other things on there. I think the notable thing today, I was just notified just a few minutes ago, we have had the second death in the state of Missouri in Jackson County. I also want to say that these numbers are changing daily. From yesterday when we were briefed, we were somewhere well over 400 tests, or I'm sorry, we're over 400 tests today. But yesterday there was 28 positive that were on there. Today there's over 46 positive cases that we know of in the state of Missouri. These numbers, I want to make sure that everybody understands, are going to continue to rise. As we do more testing across the state of Missouri, we will be finding more and more people that will test positive. The good news to that is we're identifying the people that are testing positive and trying to get them in quarantine and out of the public so we can help combat the coronavirus. We appreciate you taking the time every day to stay up to date on the situation here in Missouri. Today, I'd like to start off by thanking Missourians for their outstanding efforts to help combat COVID-19. All of our medical professionals, healthcare providers, first responders, emergency personnel for going above and beyond to help fellow Missourians. Our schools, teachers, and administrators for finding new and creative ways to continue education for our students during this time. Our local leaders for their continuing communication, coordination, and preparation in their communities. And all of the fellow citizens who have stepped up into leadership roles and asked what they can do to help. I just want to say we receive numerous calls at this office every day, people asking in ways that they could help, all the way from the private sector to individuals. I cannot say enough for what I believe to be some of the best people in the United States right here in Missouri for stepping up to do that every day to ask how they can help. Just yesterday evening, Teresa and I stepped outside to take a walk. We were so encouraged to see the amount of people practicing social distancing. We cannot do this alone. I have consistently met with and communicated with leaders across Missouri. I spoke with the House and Democrat leaders today. We are appreciative of everyone's efforts to fight COVID-19 and to protect the health and safety of fellow Missourians. That is what is going to take to get through this. Everyone working together to prevent the spread of COVID-19. This is a public health emergency, and we need uniform social distancing across the state. As of today, I am directing the DHSS Director, Dr. Randall Williams, to require social distancing. It will be targeted to gathering of more than 10 people that will be prohibited. This order will make statewide restrictions on gathering of people. This order will not be limited to gathering of people. It's not about shutting places down. It is designed to promote the health and safety of the people of Missouri. The order is tailored to avoid restrictions on businesses and organizations that promote the health and safety of Missourians. This order will not apply to religious services, hospitals, grocery stores, pharmacies, and other cornerstones of our communities. This order will also not apply to the functions of state government. We will release further details tomorrow at the briefing. I want to stress to you, we're in the process of doing that now. I wanted to release that because the weekend's coming. So I want people to understand the importance of social distancing and have gatherings of 10. We will complete that order somewhere tomorrow, and we will have that at the next briefing tomorrow. I'll be able to tell you the details of what all is in that order and how we'll promote it. Again, I want to stress to you, this is about the gathering of people, 10 people or more. It is not about shutting businesses down in this state, and it's important that we make sure that people understand that to do that. So with that, I am going to let Director Parson say a few things here, and then we'll be back for questions.
Thank you, Governor. Yesterday, I gave an update on the personal protective equipment status, and today I'm happy to report that we have a truck being loaded right now with pallets to go to our hospitals and to our emergency service personnel. Shortly after this press conference, I will join a conference call with law enforcement and firefighters statewide that will be providing them information regarding personal protective equipment and the status of our orders of that and how to receive that. So we have also stressed to our folks that we're all in this together, and we must comply with our health directives. We must comply with our current state laws. And today, we continue to receive complaints, whether it's speeding on the Interstate 70 or whether it's serving alcohol improperly with an open container. We want to stress to all Missourians that during this time period, we need to comply with all laws and all directives so that we can mitigate the effects of COVID-19 in the state of Missouri. Thank you.
I think one thing I'd like to add is I've met with both the Democrat leadership and the House leadership on the Republican side. There's one thing I would stress to everyone. This is not a political issue whatsoever. And I hope people do not try to make it a political issue. This is about everyday Missourians, is what this is about. It's about all of us should be working together in the legislature and executive branches, trying to figure out solutions to do this. I encouraged that today when I was on the phone call with both parties to realize this is a time to come together, because that's what's important about putting Missourians first. All sides agreed to do just that, and I believe everyone believes right now it is about the sake of Missourians and the safety of the people of this state and the health care of the people of this state. So with that, we'll open it up for questions.
Governor Parson, I wanted to clarify on the 10-person limit that you just said. Is that in effect as of today, or will that be coming tomorrow? You said?
We will announce that tomorrow at tomorrow's briefing. We will have a time.
There's no statewide limit on gatherings as of this moment?
That is correct. I want to be clear about that. That's what's coming. What I really want to do is come Friday, the weekend's coming. I want to encourage as many people as I can early on, not together. But it will be coming, and we'll have the time elements and exactly what that order means tomorrow.
You have mentioned that this is a tough balance between, private interests and your decision, maybe. Can you explain why you came to this decision now, where yesterday you were saying that right now you wanted to preserve that sort of individual decision on business?
Yeah, I think I think we are preserving that. I think we're still giving people the right to go to the businesses. We're not shutting businesses down. You're just going to have to do it in a moderate way. You're just going to have to know that you can't have more than 10 people in there. We're not going to prevent people from going to businesses across the state. So I think that's important that we make sure and illustrate that to the people out there, what we're doing. And I think, look, we have to do this. We're going to have to make sure we do this on our own. And it's going to come down to personal responsibility. I've said time and time again. People's got to do it. Last night when me and Teresa was walking, you really seen that engaged here in Jeff City. 50,000 state employees up here that we all know. But when you walk down that street last night, I seen everybody doing just that, social distancing when we seen it. It's one of the reasons I went out. But we all got to hold each other accountable for that and make those recommendations. So tomorrow, we'll have much more details about that we'll be able to present to you. I just wanted to make sure and let people know it was coming. The last thing I want to do is an order, and all of a sudden, half the state doesn't understand it, they don't know about it, and all of a sudden, we're trying to figure out how we're going to make sure and abide by that order.
Is dining and eating included in this? We've already seen that in urban areas across the state. Dining and eating, is that now restricted?
Yeah, I think it's going to fall into the 10-person, wherever it is, whatever business.
Meetings and government functions, are those the only exceptions?
No, there'll be more exceptions. There'll be I think there'll be some exceptions. We'll go through that tomorrow. Let me just say tomorrow when we go through there, we've got some exceptions in there, but you'll know much more details about tomorrow. Again, I just want to make sure the public knows it's coming.
Governor, there's been some reporting that there was a letter sent to your office from the Missouri Center for Public Health Excellence requesting that more restrictions be placed. Can you talk about if you consider those requests?
Yeah, I have a great deal of respect for that organization, but we get letters every day with people thinking with different ideas and suggestions, and we just have to wade through that every day. I mean, it's why we're working this weekend, trying to go through the material we have to see what it is we can do and what we can't do. But I think every day is a challenge to be able to go through that process and see how we're going to move. It's easy to make a decision today as governor. I can make that. I have the power to do a lot of things. But I also got to look what's happened 6 months from now. What's this state going to be like in a year? Because one thing I do know, we're going to survive this. We've survived tragedy in this state before. We've went through hard times in this state before. But it's important what we're going to do after that. And we got to be prepared for that. And there's going to be a tough road ahead. But we're going to survive that. That is one thing I do know for sure.
Andrew.
Governor, with a lot of people not traveling around like right now, a lot of hotels are a lot more empty. Is that a possibility to see hotels being used for hospital overflow at all?
Yeah, we've had a tremendous response from people around the state of Missouri offering up businesses. Some of the restaurants that are closing down have actually offered to utilize their businesses. Hotel chains have offered to do that. We've had a tremendous amount of support. Bookstores wanting to provide books, food chains wanting to supply food. I think it's just an outcry of what people are doing to help. I'm humbled every day to be the leader of Missouri and find out how many people in this Missouri is willing to step up. And we got a lot of days we got to go through. Look, this is just the beginning. We're 2 or 3 months at a bare minimum that we're going to have to deal with this issue. So everything we can have that we can use for resources for that to meet those goals is really important right now. And all those things might not happen today. This thing changes so rapidly every day. I don't know what the decisions of tomorrow, what we'll be doing, but I guarantee you it'll be for the benefit of the people of Missouri is what it'll do.
First,
I think we're considering everything. What you got to realize here, though, on the private sector, or even in the medical profession, we all have supply chains, and we need to go through those supply chains to get what we can to protect our employees. First of all, as a business owner, when I was in business, the first thing you want to do is make sure your employees are safe. The problem we have here, one, is just the supply and the demand. It's not a question you don't want to do it. It's a question you physically can't do it because you don't have the product. And we're working on that every day. And that's all dependent on the industry and the suppliers. But we're on the phones all day looking at suppliers to purchase. And again, it's not a financial issue. It's a matter of just finding the product out there and being able to get that product to get it back to your state.
Kelly,
Illinois, our neighboring state, has put a shelter-in-place order out. Is that any conversation here in Missouri? And what's that conversation looking like?
Look, every day we're making decisions here, just like I'm telling you today. We're making changes in that. And it depends. It depends on the caseload, what's coming up, how well are we handling that across the state. And look, I think it's important for the people of Missouri to know these numbers are going to go up, which is a good thing because we're going to identify the people that has the coronavirus. But I also think people are going to be treated for this and are going to be okay. But some people are going to die, just like the one I did the other day, just because of the circumstances we're in. But the majority of people are going to be okay. So we got to continue to be open-minded to see what we're doing to the state of Missouri every day. But tomorrow, things can change, decisions will be made, and that's why we'll be here Saturday, Sunday, and continue until we get on.
Governor, I want to talk a little bit more about testing. How many tests currently are available in Missouri? Is there still a shortfall that you guys are experiencing? And when can people who are begging right now to be tested, when they can be reassured that they in fact are going to be tested?
I think right now, the testing we have, we watch that every day, but we have the testing to do the people that come into the medical facilities today that meet the requirements to be able to do that. First, that's the most important thing we do. The people that come in and meet those guidelines, we do that. Second of all, for everyone to just be treated that they want to be treated, I think that is something that we look for long term, but that's not going to happen in the near future. That's just not, because the supply is not there to do it. So at some point, we have to have some sort of guidance within our own departments, within the own medical profession, how we're going to do that. Because you still have to take care of the people that need it, and the people that are testing positive have got to be available to test that.
Do you know when, and maybe Dr. Williams might know this too, do you know when is the next date you are supposed to receive more testing kits?
Yeah, sure. So thank you, and just want to talk about testing. It's something we talk every day. I talked to the National Director of LabCorp yesterday. Bill Whitmore spoke to the head of Quest yesterday. So the status of testing is this, is that we now have at least 6 areas, University of Missouri, WashU, ViraCorp, Quest, and LabCorp that are doing tests throughout Missouri. I want to emphasize what the governor said. We have enough tests to test those people in our state lab who we think are most needing of it. I will tell you our percentage of positives of those is 6%. So for the patients we're most worried about, only 6 out of 100 come back positive. We had conversations yesterday with Quest and LabCorp and ViraCorp, and they're now giving us their number of negatives. And I will tell you that the number of negatives, the number of positives is much, much less in what we call general surveillance. And so we find that very reassuring. We are doing hundreds, if almost not thousands, of tests based on LabCorp and Quest and others in Missouri right now. But the vast majority of those, much less than 6%, are coming back negative. So what I would want to say about testing to people, and again, it's only going to get better every day. We've talked to Quest and LabCorp. They feel very confident that more tests are coming. They are not affected by supply chain issues. But I would reassure people that of the hundreds, if not thousands of tests they're doing in Missouri, the vast majority of those are people with just a cough and fever who don't have these heavily screened criteria. They're coming back negative. Now, having said that, if you have symptoms, especially cough, fever, and shortness of breath, we very much want you to identify yourself to a provider, very much so. But at this point, we feel like that the amount of tests versus the number that come back positive is reassuring and will only get better. Thank you.
Do you have any plans to, in the near term, to lower that standard that you're currently operating at to ask for a test?
Yes, and so as you know, for your commercial labs and your providers and many of the mobile tests, I mean, the mobile sites, as I think I said yesterday, in Springfield and Mercy are doing more tests just at their mobile sites, much less their hospitals, than we're doing in our state lab. And so we'll be moving away in probably about 10 days from our international. Ours are kind of pegged very much to people who are most risk coming from. Most of the cases in this state have been travel acquired to date, so we've saved the test to make up for that. But you'll see that lessen because we have less travel coming back in now, and we'll broaden them more to domestic or statewide criteria. Thank you.
I did have a question.
Let me just make one last comment on that. When I talked to the president yesterday and the vice president, I didn't think there is no doubt that they are trying to use all the resources they have with companies, with corporations, trying to get this out, these tests out, the PPEs out, all the things that we need right now. Again, everybody is in the same shape as Missouri. Actually, some are in worse shape than Missouri, trying to find these supplies. We're all out there every day. We're looking to the private sector. We're looking for the government, federal government, but every day we're out there hustling to try to get the supplies we need. What number is that to say there's enough? I don't know that we're going to have a stockpile. I don't know we're going to have a stockpile in the near future. But we are going to try to maintain enough tests on possible to test the people that we need to meet, that meets the qualifications to be tested. That's the number one priority.
I have a question for Director Parson. You have the big job of delivering those personal protective equipment around the state. You released numbers on hospitals and EMS yesterday. Do you have numbers yet for law enforcement and fire departments, who you said next week you expect to get shipments of PPEs in that might go to them?
Yes, we're receiving requests every day. I don't have those numbers from fire departments as well as law enforcement. So a lot of demand out there for PPE in all of our public safety arena.
Do you have numbers, I guess, specifically on boxes or how many pallets are going out to hospitals and EMS today?
I don't have those specifically. So I just know I want to stress that we've had a lot of collaboration between state agencies. MoDOT, Department of Natural Resources, SEMA, the Highway Patrol are all working together to get these boxes out there. So, yeah.
Can you kind of summarize what your hope is for people's social activity in the days ahead? What you hope where they don't go, what they'll do?
Well, I hope they take the responsibility to understand how serious this is. And I hope they understand the 10 number is what it means, 10 people. And whether that's your families, my family versus my own personal experience, if I got my family together, I'm over 10. So, yes, I'll probably be able to do that, quote, by law, but probably for me to do that and other people, you need to be good stewards of this. Maybe I need to see part of my family on one day, part on another day. That's the way we're going to have to deal with that. But people are going to have to do that. Most of us have been around Missouri a long time, and we know, I believe, that people will do the right thing. I'm not saying everybody's going to be perfect about it, they won't. But the majority of Missourians will when they understand that. I have to do everything I can stress to them how important the number 10 is as far as how we do these gatherings. But at the end of the day, whether it's 10, 11, it's 7. It's about personal responsibility of people in the state of Missouri. And they have to step up and do that. And they really got to step up for people besides just themselves. Whether it's my kids, whether my grandkids, it's what you expose other people to, and you do have some responsibility of that as individuals. And we have to understand how serious that is.
Okay, we'll take one more question, and then the guy will closing remarks. Right over there.
Have you gotten any word from President Pro Tem Schatz or Lieutenant Governor Kimo about the Senate? What's the word on them getting that supplemental budget?
Yes, I've talked to both chambers about that and told them how crucial it was to get back and to get that supplemental done. Look, we got to get that done. And the legislators are going to have to find a way to get back here to the Capitol and get it done. Because one of the things that we're looking at is that federal spending that's come. We got to have the ability to do that. We are not like the federal government. We just can't all of a sudden decide to keep going by the Constitution when that money runs out. And we got to be able to have that money in there. So I've stressed the importance to them. I believe they will be back in here. We'll do all the safety precautions we can. But at the end of the day, they're the ones that have to come back in here and do that. And right now, the people of Missouri depends on them to do the right thing, and I believe they will.
Might they vote locally? Might they vote locally somehow?
Yeah, we've discussed different scenarios with them. I think they'll have to make those decisions, but whether that, I don't care where they vote, on a football field, out here in the parking lot, they come in so many at a time to make votes and they leave the boards open. Look, there's ways to do that. This is a priority for every legislator, for every elected official, no matter where you come from. This should be a priority. All right, let me just finish up. I say this every day, and I just want to mean this solution changes so rapidly. This evolves so rapidly of what we're doing every day. That's why we're trying to do these briefings that we've never done before, to try to make sure, one, we keep you engaged, to give you information, that we let the public to know that. There's new information to share all the time, virtually every hour. And we are all doing what we can to share updates with you as quickly as possible. I cannot stress enough the importance of working together and doing our part during these challenging times for Missouri. Missourians are strong and resilient, and we will get through this together. We will overcome this adversity and come back better than before. Thank you very much. Thank you.